Welcome back to Ladies of Another View, and I want to welcome back our guest, David Ridenour. He's the chairman of the National Center for the Public Policy Research, and their website, by the way, is nationalcenter.org, easy to remember. And you are a father of a mentally disabled son, wanting to let people know this is what you are up against, the demands, the system that doesn't really help your son, that they become an adversary of yours instead of a support. And before we went to break, you were going to make a point about how we treat disabled Americans like this.
Well, so I was going to mention that the Institutions of Mental Diseases was created for good purposes, which was to eliminate some of the abuse that had happened in the large institutions, but also so the federal government wouldn't incur all the expenses of the mentally handicapped if states wanted to push it on to the federal program. On the first matter, we have no way of knowing whether or not small institutions are better at protecting people than large institutions. Who is more likely to be investigated, a group home or a large institution? Who is likely to have an inspector show up? So it's more out of sight, out of mind.
Well, tell us about your son, John, right? Tell us a little bit about the story and what you went through.
So John is currently 25 years of age. Back in 2017, my wife lost her 4-year battle with stage 4 breast cancer. And the entire family went through that. And after she passed away, somehow he knew that she had passed away and he'd never see her again. And he started acting out. He became extraordinarily violent. There was one day in a 4-hour period in which he hit himself over 2,700 times in a single day. He and I were in and out of hospitals. And he actually sent me to the ER because he bit my thumb, and I didn't think my thumb was ever coming out of his mouth. He was a danger to me. He was a danger to his siblings, Chris and Kate. And we really didn't have very many options. We weren't getting help from the government. It was all up to us. And oftentimes we had the choice between restraining him and drugging him. And as a parent who really, really loves his son, that's a choice no parent should ever have to make.
Let's go to the video quickly because you have on YouTube Faces of Disability Crisis, Jonathan's story, and it's very touching. It really covers everything, and I just grabbed a little clip from it.
Unless it touches your life, you don't really know that this is going on. So I think that that's what we need to do. We need to introduce them, people on Capitol Hill, to the very real people who are affected by this. There have to be tangible, measurable standards set for federal disabilities programs, each and every one.
It's being human, doing the humanly possible thing for people like Jonathan and like every other person that does make a difference to their families.
Americans are a generous people, they're a caring people, and it's time that we take care of some of our most vulnerable.
Are we promoting the dignity of those with disabilities and promoting their independence, helping them live more fulfilling lives? That's the measurement. The greatest joy that we can get out of life is giving to and helping others.
Amen.
That's so touching. You have lived what so many parents have and families, and especially autism. The rates are so high now, and it just makes me think and wonder, how. Tell us a little bit about, you wound up taking him to the emergency room, and how did that all unfold? What did you go through in 2017 as far as the system that's in place?
In 2017, when he became violent, I took him to the ER. The ER was not equipped to do anything for him. There was a special acute care hospital that could. But it took 7 days to get him in there. And it was in part because of that IMD exclusion that I mentioned earlier. There were patients ready to go. Their treatment had been completed, but they had no place to go downstream. That place helped him, but it wasn't enough. He needed a real specialized hospital, which he eventually got into. But there was a 15-month wait. And by the way, 15 months was a short time to wait compared to what many other patients do. And it was the same thing. Again, there were patients ready to go. They had 2 patients there that had been there a combined total of 2 years longer than they had to be because they had no place to go. Their families essentially just abandoned them in that hospital. And by the way, that hospital cost $150,000 per month. So because of the IMD exclusion, because there was no place downstream for these people to go whose treatment had been completed, there was $3.6 million that was wasted while people were waiting at the door who desperately needed this treatment. So, it's not about the money. There's a lot of people who say just spend more money. We don't need to spend more money. We need to spend it more smartly. We need to make sure that there are real, tangible results for people so that their lives get better. That's
Right.
the measure.
David, you're presenting the problem, you're seeing the solution, you were helped by a solution. Are you getting involved in policy and with legislators to try to make changes, and how's that going?
Absolutely. We're just really getting started, but IMD exclusion is one of those things that we want lifted. We want it ended. Another area that we're looking at is, there's an awful long waiting list for people to get care, to get long-term care. And a big problem that we've identified is that, let's say, for example, I wanted to move to Florida. I couldn't take my benefits with me. I'd have to start all over and again, another waiting line for that. So we would like to see these benefits transportable across state lines so that we can keep families together, because the practical outcome of not doing so is that sometimes families have to be separated, and we think that that's wrong. Paperwork is another thing. Every single year I fill out paperwork this thick, every single year, for a young man whose situation is never going to change. It ought to be a postcard. But yet I go through a process, and right now I'm in a 6-month process of getting his benefits reinstated. And we just shouldn't do that. It ought to be one and done. And there's so many other things. ABLE accounts, we get to expand those further. I think that that would be wonderful, and use them to be a little bit more innovative in how services are delivered to those with disabilities.
Talk to our viewers. Explain ABLE funds, would you, please?
Yeah, ABLE account really about the 10-year anniversary of ABLE accounts. And what they are is, think of an IRA. It's essentially an IRA for people with disabilities. You can contribute money tax-free. It can accumulate, the money can accumulate through investments or whatever. And then when you need it for things that, medical care or whatever, maybe it's a wheelchair, maybe it's adaptive equipment, then you can use it for that purpose without any penalty, without any tax penalty. And currently you're allowed, I believe, to contribute about $19,000 a year, but it's capped at a total $100,000. So we're actually looking at changing that cap, because $100,000 in the overall scheme of things, when you're dealing with somebody with great needs like those who are disabled, just isn't that much money.
Right.
I'm wondering, and I know we're winding down here with time, but Ms. Robert Kennedy Jr., Head of Health and Human Services, is this something that should be coming before him?
Absolutely, this is something that should be coming before him. We have been reaching out to his department. There's a certain degree of disorganization right now because he's making an awful lot of changes, but we see that as an opportunity. What we really like about him is that he thinks outside the box. And when he talks about his department and looking over it and seeing no successes, he's kind of right. And that's the kind of thinking that we need. Somebody who is not measuring it by how much money is being spent or how many people are being served, but how many people are getting better.
Right.
And
Well,
That's huge.
David, stay in touch with us because I hope we can. We've covered a lot of things over the years where the pendulum starts to swing the other way, and we want this. We're hoping, we're expecting that's going to happen.
Yes.
So we want to stay in touch, and you can report successes to us as we go along. Thank you for joining us today.
thank you so much. It's been a real pleasure.
Thank you.
Yeah, same here, likewise. So God bless you. Thank you for being such a good dad and a good advocate for everybody else too.